Hello everyone, it's me here, Mohammed Adam. I'm presenting the quality of life of patient after colorectal surgical in Soba University Hospital, Sudan, Africa. So here we have the colorectal surgery is reported to be the significant effect on patient on both dimensions of physical and social and psychological. Infection are found to be the major risk factor in Sudan and sub-Saharan Africa, such as intestinal schistosomiasis and colitis, especially those presented with sigmoid colonic adenocarcinoma. So the aim of our study here is to assess the quality of life after colorectal cancer surgery and the effect of the stoma in their life. So the method of our study, this was a descriptive cross-sectional hospital-based study, was done at Soba University Hospital, Khartoum, Sudan. The sample was 72 patients with colorectal cancer who underwent colorectal surgery where it was included. The data was collected using the standard SF-36 of quality of life questionnaire that contained the following domain. First, it contained the physical function, the role limitation due to physical health, the body pain, the general health, the emotional, the energy and fatigue, the social function, the limitation due to emotional problem, the mental health. So we found that this is the firstly we have the patient information. It was, as mentioned, 72 with the mean age of 51 plus or minus 14.6 years. As 79% were married, 70% were working, with the free labor business of 36.1. The level of education here is illiterate for about 21%. Here we have the second Khalawi or Khalwa was about 30%. Khalwa is the traditional education institution here in Sudan that concerned with teaching the basic of the religious education and the basic of writing and reading. Then we have primary school of about 30%. Secondary school was about 18%. University was 1.4%. So here we have the overall quality of life for the whole domains, the 8 domains of the SF-36. So here we have the general health of mean of 60.5 plus or minus 16.1. The physical functioning was 74% plus or minus 24.6. The role limitation due to physical health was about 59.4 mean plus or minus 38.8. The role limitation due to emotional problem was 70.8 plus or minus 31%. The pain or the body pain was of mean of 61.8 plus or minus 25.7. The energy and fatigue was 60.2 plus or minus 30%. The emotional well-being was 72.4 plus or minus 23.2. The social function was 49.5 plus or minus 11.8.9. This is what the mean plus or minus the standard deviation for the whole population. So here we have the quality of life categorized according to the presence of the stoma for patient with colorectal cancer. So we have the crosstab between the stoma complication, yes, the presence of stoma complication, and the main domains of the general health, physical function, role limitation, and the others. So it's found that the physical function and the role limitation due to physical health was the more linked and the more associated with the presence of complication, are more affected with the presence of complication of the stoma by the mean of 58 plus or minus 22.7 for the physical function, and by 40.5 plus or minus 39.24 for the role limitation due to physical health. Discussion here we have, the study showed that several patients lost their job after the operation due to physical limitation. Most of the patients reported an improvement in their general health compared to a year ago. All scales are higher in patients with no stoma compared to the patient who have a stoma. Among the different components, the social function are the most affected when compared to the rest of the component, with the physical function being the least affected. So this comes with agreement to the study conducted in the district of Modena, where the patient were actively physical activity and the diet remained virtually unchanged 5 years after the diagnosis of the tumor. So social function themselves showed that the difference between employed and unemployed patient was the employed have more social function than the rest. So in conclusion, our result found that the quality of life was affected negatively in terms of the level of pain and presence of colostomy with sexual activity after sexual activity affection, but the other parameters were not strongly affected. No association were found between the quality of life in different components from one side and with the gender, age, level of education, marital status, the occupation, diagnosis, or type of operation on the other side. This is mostly due to high level of satisfaction in Sudanese population, and especially those strongly believer in Islamic religions. They have high level of satisfaction and they are believing on the being in life is the most goal that they have. So here are the references that I used to do this work, and thank you so much for your time. This is my contact for further communication.